Welcome to Recovery 360, the podcast dedicated to exploring the pathways to treatment and recovery, brought to you by Recovery Centers of America. I'm Lorraine Ballard Morill, Director of News and Community Affairs for iHeart Media Philadelphia, and I am joined by Tony Luke Jr. Tony?
Hello, Lorraine. Another show. This is amazing.
Yes.
Well, we are thrilled to be your guide on this journey towards better understanding the world of healing and the many ways individuals find their way to recovery.
In every episode, we'll sit down with experts, survivors, and advocates in the field of treatment and recovery. We'll unravel the complexities of addiction, mental health, and physical wellness while shedding light on the diverse range of therapies, interventions, and approaches available. In this podcast, we're going to be taking a look at the range of treatments available, and there's a lot of those. There have been tremendous advances in the treatment of substance use disorder. In this edition, we'll be talking to experts about the latest treatment strategies. From Recovery Centers of America, we have Dr. Pete Vernig, VP of Clinical Services, and Brian Haney, VP of Outpatient Services.
Substance use treatment options vary depending on the severity of the addiction, the specific substance being abused, and the individual's need and preference. We'll discuss some of the inpatient, outpatient, medication-assisted treatment, MAT, partial hospitalization programs, also known as PHP, intensive outpatient programs, IOP, lot of initials here, and general outpatient treatment, GOP, not to be confused with the political GOP. So let's start with medical detox.
Absolutely. And, Tony, we love our initials in healthcare. So I'm glad that we're doing this to kind of break it all down, because I know how hard it is for people. You look at all of these options and it's tough to kind of break them out and see, what would work for me. But when we talk about detox, and a lot of people are starting to call this withdrawal management instead of detox. But what we're talking about is sort of that highest level of need where we have somebody who is withdrawing from the substance, and that means the process of the body removing that substance and filtering the substance out, and the effects of the substance starting to be diminished. But as a result of that, there's sort of a rebound. So if you think about the high that somebody gets when they're on the substance, when that drug is withdrawn from the body, they go through a low. And oftentimes those are opposite symptoms to the high. So if somebody is really active and feels really good and euphoric and happy when they're high, when they go through withdrawal, it's the opposite of that. It can be feelings of depression and anxiety and physical pain in the body and feeling just like somebody wants to crawl out of their skin. And importantly, withdrawal can actually, for some substances, be physically dangerous. So the idea of withdrawal management or detox is medically managing that withdrawal period so that, number one, the person doesn't have to experience all of those symptoms. We're able to provide medication and support around those symptoms so that it isn't, the old idea of cold turkey or, you have to suffer to get through it. That's not the case. It's helping somebody to be safe and comfortable during that period of time, but also monitoring for safety. So, a detoxification or withdrawal management program is going to be a 24-hour program with medical and nursing staff who are going to monitor the person for safety. If somebody gets into a situation where they have a physical reaction that's potentially dangerous, it's able to be treated, and it's able the person's able to go through it more comfortably. So basically, this is, anywhere from a few days to a week to get somebody through that initial period as safely and comfortably as possible so that they can get that start on their recovery. So that's what this level of care is really all about.
It's so interesting that you talk about it's not like cold turkey. And I think that we all have this certain image in our minds of like movies like Lady Sings the Blues with Billie Holiday, wrapped up in one of those padded cells and going through this tremendous pain and agony. And you're sitting there watching this and you're thinking, I would never want to go through that. And I'm sure a lot of people who are in substance use addiction are also thinking that. They're thinking, oh my gosh, if I go off this, I'm going to experience all of the things that we see in popular media that people go through when they go, quote unquote cold turkey.
Definitely fear of withdrawal symptoms is one of
Oh,
the
dope sick
initial
is horrible,
barriers.
yeah.
Yeah. To somebody getting into recovery is that fear that, I don't want to go through that. And it's an awful, painful experience. So, I can imagine that being such a barrier for folks.
Well, Brian, let's talk about some other options. Inpatient rehabilitation is good for some people, and for others, outpatient treatment is the best option. So I wonder if you could kind of break it down for us, the difference between the two, and what are the pluses and minuses?
Sure. It all depends on, the level of acuity that the individual is experiencing at the time. Inpatient levels of care tend to be 24 hours round the clock levels of care that, as Dr. Vernig alluded to, often includes nursing support. Typical length of stay really varies. It could be from, on average, say 1 month to really several months of care. Within that level of care, the individual is also receiving therapeutic supports in terms of attending group, individual therapy, and really just to stabilize that individual further if they admitted initially to detox. You can think of it as like a progression of care where you're stepping down from, say, detox level of care to inpatient, and then ideally to outpatient levels of care.
Well, there have been great strides in medicated assisted treatment. Tell us how it works and the medications involved. In our next podcast, we're going to do a deep dive into MAT. But for now, give us some summary of MAT, please.
So medication for addiction treatment is exactly what it sounds like. It's medication that's used to help to treat the symptoms of a substance use disorder. So as we've talked about a lot, there's such a physiological component, the effect that the drug or drugs have on the body. And MAT, sort of broadly speaking, is a group of drugs or a group of medications, because these are prescription medications that are provided under the supervision of a licensed prescriber. They're a group of medications that will help to, first of all, manage withdrawal, as we talked about, help on the longer term to reduce the cravings, the physiological desire for the drug that people experience, and all of the psychological components that go along with that, and really help people to get in meaningful long-term recovery. So these can be things, a lot of times people think about things like methadone, which has been around for a very long time and certainly helps a large number of people. But there are many newer medications, things like buprenorphine, naltrexone, that can be a part of somebody's treatment. So, it's the same idea that somebody doesn't have to go through the pain of withdrawal without support and, medical assistance. For many people, a barrier to the next phase of recovery, or that phase, when somebody is in a residential program or in an outpatient program, are the cravings that they'll get for the substance, and the effect that substance had on their nervous system, on their brain. With their brain chemistry, we're able to give medication that's going to help them get through that as well.
Now, there are some treatment options that are tailored to different levels of need, including partial hospitalization, intensive outpatient program, and general outpatient program. I wonder, Brian, if you could tell us the difference between them and how they address the needs of the patient.
Sure. I think what makes this level of service unique is that it allows the individual to still be a meaningful participant within their family and their community at large. So when you're talking about partial hospitalization level of care, typically speaking, it's about 6 hours a day, 5 days a week. And within that model, the individual is participating in group therapy, individual therapy. And what's really unique about that is it allows the individual to utilize the skills that they're learning throughout the treatment day within the home, like the home environment or the community at large. And that's really should be the goal of any service provider, is to allow the patient to generalize their skills in the environment that really where it matters most. It's a less contrived setting, less staff intensive, and really is setting that patient up for success. It looks a lot like an individual is going to work and participating throughout the day, and really is setting them up for success to again reintegrate back into the workforce or to the community at large. large.
I wonder if we can also talk about the demographics
Sure.
of persons going into treatment. How does that, who they are and what they do, impact what might be the best choice for them regarding outpatient or inpatient?
Yeah, great point. I think, you know, what we would want is really some treatment is better than no treatment, right? And the general the outpatient level of care allows the patient to meaningfully participate to within their community, and so individuals can still be meaningfully employed. It could be you could have childcare constraints, and really those circumstances could be a barrier to an individual seeking a higher level of care. And so really the outpatient level of care allows the individual to still receive effective treatment towards their recovery, and also allows them to still more meaningfully participate in those circumstances within their life.
Well, behavioral therapy play a crucial role in substance use treatment, addressing the physiological and behavioral aspects of addiction. Here, I'll discuss there are prominent behavioral therapy modalities: cognitive behavioral therapy, again, CBT, dialectical behavior therapy, DBT, and the 12-step approach. Can you break down what each one entails?
Sure. So CBT is something that a lot of people have heard of before. Cognitive behavior therapy. Like I said, we love our abbreviations, but CBT is an umbrella term for a large group of interventions. And what they have in common is they're focused on the way people think, the way they feel, and the way that they act or their behavior. And most importantly, the interactions between those. So it's a very present moment focused treatment. I think people think a lot of time about getting therapy as, I'm going to lay on the couch and talk a lot about my childhood. And there certainly is a place for that. And even within CBT, there may be a focus on things that happen to a person in their childhood. However, the focus in CBT is on what's going on in the moment. So what about my emotions is impacting the thoughts that I have? And what about the way I think is impacting how I feel? And how do these impact my behavior? The example that I like to give most often for CBT is actually depression. So one of the things that happens with depression is oftentimes a lack of energy. So imagine if when you woke up in the morning, you just barely had the energy to get out of bed, and the greatest struggle was just to get up onto your 2 feet and get out of bed. What kind of thoughts would you have related to that?
Oh, I've absolutely been there.
I think we all have at some
Yeah.
point or another in our
Yeah.
lives, for sure.
Yeah. And so that causes a person to have oftentimes will impact the way a person thinks negatively. And so, what's going on? What's wrong with me? Why do I feel this way? And then that impacts the way that a person feels. Because if I'm having negative thoughts about myself, if I'm telling myself that there's something wrong with me, or that I'm making a mistake, or I can't succeed, that's going to impact the way that we feel. And the way that we feel ultimately impacts our behavior. And so it's working on the relationship between those three things, and kind of finding ways of, learning new skills, new ways of managing our emotions, new ways of thinking about how we think. So if when I have a negative thought, I can sort of catch that thought and be aware of the fact that, oh, that's the depression talking, or that's the substance use disorder talking, and maybe change that, replace that with something more positive. That's one of the core functions of cognitive behavior therapy.
Yeah. I think what's interesting is that, as we've talked about in other podcasts, really, we're talking about mental health, that we really can't separate substance use disorder from people's mental wellness. So until we begin to look at the factors that are causing the behavior of self-medicating, right, then you really can't get to the next step. It's important for us to deal with that. Certainly CBT is one way to do that. There's also another set of initials, and that is DBT. Tell us about DBT.
So dialectical behavior therapy is based on it's actually it's related to CBT. It's a set of skills that's taught in a very organized way. Now you talked about self-medication, and I think that's a really important piece, that when somebody's self-medicating, as we've talked about a lot in here, how people have underlying depression or anxiety or trauma or other things going on, and the drug is being used to manage that. What we're asking somebody to do is take that thing away, take that thing out of their life that is what they've found that helps them to manage how they're feeling. It's the only way they've found to manage their depression, or to manage the struggles that they have in their family, or to manage the experience of trauma that they have in their life. We have to give them something to replace that with. We can't take away a coping skill without giving something new. So DBT is a set of skills, a very organized set of skills related to our interpersonal relationships, how we relate to our emotions, how we deal with stressors and problems that do come up all the time in our lives. And it teaches people and helps people to practice these skills so that they're able to find something to replace that with. And obviously, it sounds very easy the way that I explain it, and it's not very easy. It's actually very difficult, and it takes a lot of work on the part of the individual. But if we can try, 10 different things and one of those things works, that's a win. We have one skill that's going to help the person, or that they're comfortable trying in their life when they're experiencing, those strong emotions, or when they're having a craving. And, again, that integrated for some people with the medication for addiction treatment can be so helpful.
Right. Tony, I know that you and I have certainly heard about 12-step, the 12-step program, right? And that's again, something that popular culture really does a lot of examination of. And I wonder if we can talk about that. I mean, 12-step program is something everyone is familiar with, but what actually is a 12-step program? Brian, you want to jump in? Or Dr. Vernig?
So the 12-step approach is based upon, as you said, 12 steps. So it is a progression of steps that a person goes through towards their recovery that involves joining a fellowship of others. I think that that's something we've talked about as well that's so important, is that it's not something somebody does themselves. It involves a group of supportive individuals, people who, in the case of a 12-step program, generally have been through some of the same things. I mean, nobody's life looks like anybody else's, but they've experienced some of the similar struggles, some of the similar issues that they have. And working through those steps, there's active work, similar to CBT and DBT. There's active work that they're doing in order to move forward in their life, looking at the way that their disease has impacted them, looking at the way it's impacted their family and their relationships, and ultimately bringing in the spiritual component as well. I think that that's one of the things that 12-step models or 12-step programs do so well, that, maybe it isn't a focus in CBT or is less of a focus in DBT, that it looks at the person's spiritual wellness and the way that they relate to a higher power that can be spiritual, or it can just be something outside of themselves that's important, that they respect and that they believe in. So a 12-step approach, it can be anything from a group that a person attends at a treatment program to 12-step meetings like AA or NA that exist. They're all over the place in the community. That's one of the wonderful things about the 12-step approach, is that it's available everywhere, and that, somebody who needs support, they can reach out in the moment and find that support ready, willing, and able to help them through a difficult time.
Right. And I like the idea of having like a mentor, a sponsor
Mm-hmm.
that can just always be there for you when you need them.
Okay, so I'm going to do it again.
Do it. Go ahead. Speak your piece.
I'm going to do
Tony.
it again. Okay. I know many people where the 12-step program, and has been life-changing. And I believe that what the 12 steps teaches is incredibly important. Taking responsibility, owning up to what you've done, asking for forgiveness, forgiving others as well. But there is a huge downside to the basic structure that bothers me. I'm trying to compare for our listeners to understand it so it doesn't get kind of technical. When you're on it, let's go to food because everyone can relate to food. Okay. So when you go to a popular food program, and I won't mention any names of the programs. Okay. So they'll make your meal for you. You'll eat this meal. It has the amount of calories that you're supposed to use. Okay. You're supposed to go to the gym. You're supposed to do these things and you do them. But what happens is you can't survive the rest of your life doing that structure because it becomes about willpower. And willpower, no matter how strong you are, will break down, which is why people who lose 100 pounds, 150 pounds, or get their stomach stapled, or they do all of these things, and then, they lose all of this weight, and then 4 years later, they're as big as they were, if not bigger, because you're relying on a group and a system that is so structured that if any of those things in the perfect storm get out of whack, we resort to what we know works for us.
Right.
For me, it's carbohydrates. I'm just being honest. So when I do the diet and my meals are made, of course, life is easy when all the meals are made and everyone is looking over my shoulder going, no, it's 8:00. Don't do that. Don't eat that. Of course, I'll stay thin the rest of my life if there's an army of people around me forbidding me to do anything I want to do. So as much as I believe that the 12-step is vitally important, it becomes a crutch again. And I'm vehemently against the crutch. You have to find why you are self-medicating. You have to find out the reason that you're doing these things so that you can face that head on, get through that, and not need to have all those support systems, because it's like, okay, I see why I'm doing this. I know why I'm overeating. I know that I'm using this to self-medicate. Let me try music. Let me try art. Let me try whatever it is you want to try. So again, I'm not knocking the 12. I want to be very clear. I think that the 12 steps are vitally important. I believe, though, it becomes not a good thing when the 12 steps become the crutch of your existence.
I think that that's really actually an excellent point. And I think that that's why this kind of discussion about the wide variety of treatment modalities is so important to know, because I think you're right. When it comes right down to it, we can't rely on externals to make changes. We have to check inside first and figure out inside what it is that's been pushing us towards self-medicating and all the different things that people do to hide the pain, right? So that, Brian and Dr. Vernig, that's really why it's like one size does not fit all. Is that right? I mean, Brian, we talked about all these different options because everybody's different.
Correct. Yeah, it's about to Tony's point, it's about it can't be solely 12-step. It has to be a combination of ideally, kind of empirically supported interventions, things that have been tested over time. And again, like providing patients with options. And I think it's about skill acquisition and the individual really learning these different strategies, be it CBT or DBT, in concert with other modalities, to really provide the best options available to patients. That's really what we should be looking for in a service provider.
Right. Dr. Vernig?
Yeah, I mean, you've both hit the nail right on the head with that. It's no one thing works for everyone. And, the 12-step approach does not work for everyone. CBT or DBT program alone does not work for everyone, which is why, and inpatient or outpatient, the same thing. Everyone is different. Everyone's life circumstances are different. I think that Brian had talked about the severity of the illness for some people. That's something that we've discussed in here before, is how far along people are, and having that treatment as early as possible available for people. So it depends upon all of these factors. And for some, it could be a very traditional inpatient detox followed by a rehab program, followed by a step down through outpatient. For some people, it's going right into an outpatient program. For some people, it is a 12-step program. For some people, it's CBT or DBT. For some people, it's both because they actually fit together very well. A lot of people look at these options as mutually exclusive. And, are you going to have a CBT program? Are you going to have DBT? Are you going to have 12 steps? Are you going to have MAT? They all fit together very well. And it's really about that individual, I'll even call it individual prescription for the person, because in the same way that in any other part of healthcare, no two people get the exact same treatment, regardless of the illness, regardless of the injury. It's based upon the person's risk factors. It's based upon the severity of the case. It's based upon so many different things. And for the longest time, we haven't looked at substance use disorder that way. But one of the exciting things is we're starting to look at it as, the rest of the healthcare system does, that we need individualized treatment. We need things for some people like music and art and other outlets for them that can also be a critical part of that prescription for treatment.
And you need an outlet. And it's funny because even the medical community now, like the newest thing that because I have a lot of friends who are medical doctors, the newest thing now they're trying to do is work with people's DNA so that when they get an illness, they will prescribe medication based on your personal DNA, so that the side effects are reduced or eliminated. Because again, like treatment, one size doesn't fit all. One pill doesn't fit all, because the side effects sometimes of a medication is worse than the illness that you're going through. And I've said this before in other podcasts that we have done together. I can't applaud you enough for constantly saying that, hey, we need to look at the bigger picture, because for years it wasn't. The picture was, here's the disease, this is what we do, you're on your own, get some support, I'll see you back again in 6 months. No doctor wants to give someone or treat them for cancer and go, oh, I'll see you in 6 months with a new cancer. No, who does it? No one. But for years, that's the way it's been looked at. And I love the fact that it is changing. I love the fact that you're advocating that addiction is not cut and dry, that there is a mental and trauma component to this that has to be addressed as much, if not more, than the actual physical addiction to the drugs.
Agree completely.
And the other thing too, and we've talked about this before, but I think it bears repeating, and that is you don't have to wait till you hit rock bottom.
Right.
You don't. There is a continuum, and you can jump into treatment at any point in that continuum. It doesn't have to be, when there's absolutely no hope and you're near death and everyone's given up on you, but there are different levels or stages in which you could actually jump in and get treatment. You don't have to wait till you're absolutely in the most desperate place possible, right?
Agree completely. And I think that's what's unique, just to kind of echo Tony's sentiments, is that if we look at this, if you had an underlying medical condition and sought out a healthcare provider, you would leave that office with a comprehensive 5-year strategy to address that underlying medical condition. And we have to look at substance use disorder and addiction in the same light, in that it is truly, a continuum, in that, like we've talked about, you don't necessarily, maybe a higher level of care is prohibitive, or for one reason or another, you're just not willing to commit to that level of care. So there is options available to people out there, in that a lesser option could be an intensive outpatient program that is typically 3 hours a day, 3 days a week, or 5 days a week, or what have you. And then you have your general outpatient level of care, which is typically meeting one-on-one with an individual therapist. But the point is that entry into a system, or entry into a level of care. And then you're able to kind of move up and down, if you will, as the needs as your needs change, as life circumstances change. And I think that's really what's unique about, the recovery world itself, is that there's a lot of options out there available to people.
Right. Personalized treatment plans developed in collaboration with healthcare professionals can improve an individual's chances of achieving and sustaining sobriety. That's just the bottom line.
Yeah. Well, Recovery 360 isn't just about stories of survival from substance use disorder. We're hoping, and our goal is it is a resource for those seeking answers, support, and hope, whether you're personally navigating the terrain of recovery, or you're here to learn how to be a better ally. The podcast is a source of information, inspiration, and empowerment. I mean, that's what we're trying to do here.
Absolutely. And I just have to tell you, Tony, I just love that we're doing this together, because everything that you've had to say and share from your personal experience, I think really hits home to anyone who's going through either substance use addiction or lost somebody to that syndrome. And I think it's so important. And the two of you, Dr. Peter Vernig, Vice President of Mental Health Services, Brian Haney, VP of Outpatient Services with Recovery Centers of America, you bring a lot of information that I think a lot of the general public don't even know about.
Yeah.
We're not even aware. As we've done each podcast, I've learned something new. I've learned something important that I can bring out into the world amongst the people that I know and love as well. So thanks to all of you. Dr. Peter Vernig, if people want more information about Recovery Centers of America, where do they go?
If people want more information about RCA, or they want to learn about these different treatment options which are available, whether it's at RCA or not, we have a lot of information on our website, rcarecovery360.com, or you can call us at 844-25-RECOVERY.
Fantastic. Well, see you next time.